Hello everyone, myself Marcus Rokit. I am a second crop MBBS student from Nilratan Sarkar Medical College and Hospital.
Today, my topic of discussion is temporomandibular joint. From the name itself, you can clearly make out that this means a joint between the temporal bone and the mandible bone. So the bones involved are temporal and mandible. What is the type of joint? The type of joint is synovial joint. It is a condylar or bicondylar variety of synovial joint. Why bicondylar? Because one single joint here in between the temporal and the mandible is condylar, but one TMJ cannot act solely. Always both the TMJ act simultaneously. So we can call it as a bicondylar variety of synovial joint. Okay. Now let's see what are the articular surfaces of the temporomandibular joint. Let's draw a very easy diagram of temporomandibular joint. See, this is the articular tubercle of temporal bone. Here comes the mandibular fossa, and then here is my external auditory canal, and here is my mastoid process, right? And if these are the things, and here it will come the head of the condylar process of mandible, this one, and here it is my coronoid process, and so this is my ramus of mandible, and here will be the body of the mandible. So this is a very easy diagram of temporomandibular joint. So what are the articulating surfaces? The articulating surfaces situated above is this articular tubercle. This is the mandibular fossa, right? And the below surface is formed by the head of the condylar process of mandible. Okay. Now, in case of all the synovial joints, the surfaces are covered by cartilage, but usually those cartilages are hyaline cartilage. Here comes the exception. In case of the temporomandibular joint, the surfaces are covered by fibrocartilage, not hyaline cartilage, right? And in this joint, there lies a articular disc inside the joint, which separates the joint into an upper compartment and lower compartment. Let's see the diagram. Here, I am taking the blue color. Here there will be a articular disc, which will separate this joint into an upper compartment and a lower compartment, right? So this was about the temporomandibular joint. Now let's see what are the ligaments of temporomandibular joint. There are some true ligaments and there are some false or accessory ligaments of temporomandibular joint. Why there are true and false ligaments? The ligaments which are directly related to this temporomandibular joint and helps in stability of this joint are true ligaments. The ligaments which are situated a little distance apart from this joint and not directly related to this joint but help in giving some stability to the mandible bone are the false ligaments of this joint. What are the ligaments? The true ligaments are capsular ligament and the lateral temporomandibular ligament. Articular disc is also enlisted in the column of true ligament of this joint. Whereas the false ligaments are stylomandibular ligament and sphenomandibular ligament. Let's see some diagram of these joints. Let's see a 3D diagram. I am using Anatomy Learning 3D app, which is freely available in iOS platform. Okay. Now let's see. Here, this bone, this bone is my temporal bone, and this bone is my mandible bone. And here is my temporomandibular joint. You can clearly see that the fossa, this fossa, this fossa is the mandibular fossa, and this one is the head of the mandible. In between these two surfaces, the joint which is formed is the temporomandibular joint. Now about the let's see about the ligaments. Here it comes. This one is the articular capsule or the capsular ligament of the TMJ, and this one just lateral to it is the lateral ligament, lateral temporomandibular ligament. Right? These are the true ligaments. And what are the false ligaments? The false ligaments are here. Here is one ligament attached to the angle of the ramus of the mandible. This one, this one is my stylomandibular ligament, and another one which is coming from the spine of the sphenoid bone and getting attached to the lingula. You can clearly see there. There lies the lingula of the mandible bone. Here lies the lingula of the mandible bone, right? From the spine of the sphenoid to the lingula of the mandible, here lies the sphenomandibular ligament. These ligaments helps in giving some stability to the mandible, and so these are called accessory ligaments of the temporomandibular ligament, right? And now, what's the function of this lateral ligament? Lateral temporomandibular ligament. You can clearly see that the direction of the fibers of this ligament are backwards, downwards, and backwards. So this will prevent the hyper retraction of the mandible. What is retraction? If someone punches here in your chin, the mandible will try to go backwards, right? Retraction, that will be prevented. Hyper retraction will be prevented by this lateral temporomandibular ligament. If the punch is pretty hard, then this will break and mandible will go back and it will hit this tympanic plate and it will rupture the tympanic plate, right? So this is what happens if someone punches pretty hard in your chin from the front, right? So these were the two important ligaments. And one more thing is there. What are the attachment of this capsular ligament? This is very much important according to your university exam. You can clearly see that the capsular ligament is attached in its above surface to the articular tubercle in front, around the periphery of the around the margin of the mandibular fossa, and in the posteriorly it is attached to the squamotympanic fissure, and in and if we see its lower attachment, it is attached to the neck of the condylar process of the mandible, right? So this was all about the ligaments of temporomandibular joint. Now let's see about the articular disc. The articular disc is actually a disc made of fibrocartilage, right? It is a fibrocartilage, and this disc, if we see its upper surface, it is concavo-convex from before backwards because of the presence of the articular tubercle, which is convex, and the mandibular fossa, which is concave. So reciprocally, this disc is concave forwards and convex backwards if in its superior surface. But here you can clearly appreciate in its superior surface this is concave and here it is convex. But if you see its inferior surface, this is concave. So the articular disc is concavo-convex in its upper surface and concave in its lower surface, right? This disc has separated the joint cavity into an upper compartment and a lower compartment. please don't forget here one very important thing, that the upper compartment major movement is gliding and sliding movement, and the lower compartment, the major movement is rotatory movement. That is, when we protract and retract our mandible, this is one of the movements of the TMJ, that is protraction. This one, the mandible comes forwards. Retraction, the mandible will come backwards, right? These movements are actually gliding movement, gliding or sliding movement. In case of gliding and sliding movement, the upper compartment usually provides the movement. In that case, if my fist is the head of the mandible and this is the cartilage, then this movement will take place like this. The cartilage and the mandible will move like this. So the movement is taking place in the upper compartment. But when we are talking about the rotatory movement, that is elevation and depression of the mandible, as in when we our close and open our mouth, elevation during closure of the mouth and depression during opening of the mouth, that is this one, ah. So those movements are done in the lower compartment, right? Then the upper compartment is fixed and the movement is done in the lower compartment, right? So this was about the articular disc. One more thing. The articular disc is attached to the capsular ligament in its periphery. You can clearly appreciate in this diagram that these green ones are denoted. This denotes the capsular ligament, and this one is my articular disc, which is attached to this capsular ligament in its periphery, right? And the anterior surface of this capsular ligament receives the attachment of this lateral pterygoid muscle, right? Achha. So this was all about the articular disc. And for these ligaments, I have already discussed what are the uses. There are some relations of the temporomandibular joint which are not very much important for your exam, but you can pause the video and take a screenshot if you want to know about the relations of the temporomandibular joint. Uh, Now let's see the major arterial supply of the temporomandibular joint. The temporomandibular joint receives the major chunk of arterial supply from the superficial temporal artery, closely related to this joint, and the maxillary artery also. And it is supplied by the auricular temporal nerve and mesenteric nerve. They are also in close proximity to this joint, right? Now, if we are talking about a joint, then there should be some movements. It is a synovial joint. So, what are the movements involved in this temporomandibular joint? The movements are depression, ah, not that depression after reading a lot of things and thinking that what will happen to me, not those depression. This is a depression movement, right? This one, mandible is getting depressed. Elevation, oh, closing, don't bite anymore, but during biting we do elevation movement. This is elevation. Protraction is nothing but taking your mandible forwards. Retraction, just before the opposite to it. And side to side movement. These are the side to side movements, right? These are the movements involved in this temporomandibular joint, right? Now, what are the muscles involved in these movements? Protraction movement is done by two important muscles when act simultaneously: lateral pterygoid and medial pterygoid. If they contract, they helps in protraction movement. Retraction movement is done by posterior fibers of the temporalis and deep and middle fibers of the masseter, digastric, geniohyoid muscles. Elevation movement is done by masseter, temporalis, medial pterygoid, and depression movement is done by lateral pterygoid. This is the only one muscles of mastication, which helps in depression movement. The other muscles which helps in depression movement are actually the muscles which get attached to the lower surface of the lower edge of the mandible and are actually the muscles of the neck region and mouth region, right? Geniohyoid, mylohyoid, digastric, these muscles actually pull the mandible downwards and helps in depression, right? Now, let's say a diagram of this temporalis muscle to understand the movements, right? This is the temporalis muscle getting origin from the temporal fossa and getting attached to mainly the coronoid process, right? So, if you see the direction of the fibers of this particular muscle, the fibers are going downwards and the posterior fibers are going forwards. So, obviously, if these fibers contract, it will pull the mandible upwards, so it will help in elevation, right? And if these fibers contract, this will pull the mandible backwards. So this will help in retraction movement. Very easy to remember. No need to maga. These are all things to be understood, right? So temporalis helps in elevation movement and retraction movement. Now, here is the masseter muscle. You know, masseter have two types of fibers: the deeper fibers and the superficial fibers. If you should see the superficial fibers have the direction downwards and backwards. So if they pull, they will pull like this. Now remember the physics, it has two components, this and this. If this component works, then it will pull the mandible upwards, that is equal to elevation movement. And if this component works, that is, it will pull the mandible forwards. So this is protraction movement. Very easy. So masseter, this is for the superficial fibers. And if we see the deeper fibers will pull the mandible backwards, right? The direction of the fibers are just opposite and they will pull the mandible backwards and help in retraction, right? Now let's see, here is the lateral pterygoid. This muscle is my lateral pterygoid. Lateral pterygoid is getting attached to the head of the mandible, right? So they will pull it forward and that will lead to depression of the mandible. And if they pull it forward, so this will lead to the forward movement of the mandible and that is equal to protraction, right? Depression and protraction. And and the side to side movement occurs around a vertical axis, right? That occurs around a vertical axis and that also that involves both type of movement, that is rotation movement and sliding movement. One side rotates and another side just glides over the uh, mandibular fossa, right? In that case, side to side movement, the muscles involved are lateral and medial pterygoid. Lateral and medial pterygoid occurs just alternately. That is, lateral and medial pterygoid or acts alternatively to bring out the side to side movement. In case of side to side movement, if the left lateral pterygoid and the right medial pterygoid contracts, that will lead to the chin moving towards the left, like this. For this movement, chin moving towards the left needs the contraction of the left lateral pterygoid and right medial pterygoid. Right. Coming to the clinical aspect of the temporomandibular joint, the most common dislocation in this joint is anterior dislocation. But why? Why anterior? Because if you see, you can clearly appreciate that in all the other sides, it is bound by bone, but anteriorly, there is only one small tubercle limiting it from getting dislocated. So, this is very easy for the temporomandibular joint to get dislocated anteriorly. When we yawn pretty hard, like this, the mandible goes pretty downwards and there is a torque moving in the condylar process of the mandible, and the condylar process goes from the goes out of the mandibular fossa and comes in front of the mandibular fossa and remains there. And then you cannot close your mouth again, right? This is the most commonly faced problem in the TMJ. Now, what to do? For reduction of this temporomandibular joint dislocation, anterior dislocation, you have to put your two thumbs inside the patient's mouth, push the lower jaw a little bit downwards, and push the jaw a little bit backwards, and release your hands. Boom! The dislocation is replaced. So this was the clinical aspect of TMJ. So this was all about the temporomandibular joint, which you are going to need in your university examination and also in your further examinations. So for this, for today, this much. Hope you have enjoyed the puja very well, and you will do very good in your upcoming exams. Best wishes. Tata. Bye bye. If you have any questions, please put them in the comment section. And if you like the video, give a thumbs up. Thank you.